Dr. David S. Feldman, MD, is an internationally recognized American board certified orthopedic surgeon who stands at the forefront of complex pediatric and adult orthopedic procedures and treatments. Dr. Feldman is currently the Director of Spinal Deformity and Hip Preservation Centers at the world-renowned Paley Institute in West Palm Beach, Florida. Dr. Feldman is an expert in the care of spinal deformities such as scoliosis and kyphosis and specializes in treating patients with complex conditions such as arthrogryposis, acrodyoplasia, MHE, hip dysplasia, Legg-Calve-Perthes disease, lower limb deformities, and limb length problems.
What is scoliosis? How common is it? What are the conditions that cause scoliosis, if any? And is it more common in children, adults, or both?
This is a great question. So that is the overview. I mean, scoliosis is just a curvature of the spine. And in most cases, it occurs for no reason. We don't understand it. It's called idiopathic, meaning that it happens, but we don't know why it happens. It does run in families. And it's pretty common. While it may occur in 1 in 8 girls or 1 in 6, and the same in boys, it gets more severe in girls than in boys. Most often it presents right around puberty, usually before puberty, anywhere between the ages of 10 and 13 in a girl, anywhere between the ages of 11 and 14 in a boy. And that's when it usually occurs. And there's nothing else associated with it. You just get a curvature of your spine. And we try to look for reasons why people get it, but we don't really understand why people get it. And then you have all these associated conditions that can be associated with scoliosis. And that list is endless list. I mean, neurologic injury, hemiplegia, cerebral palsy. Those are very common conditions that are associated with cerebral palsy. Upper extremity amputee could be associated with scoliosis. So there are many conditions that can be associated with scoliosis, but in the majority of patients, it occurs for no reason, just happens, and it occurs in childhood, early adolescence most commonly, but it can occur from birth until the elderly. It's even different in the elderly than it is in the young people. So I think it's a broad topic of curvature of the spine that occurs in many different ages. But if we're talking about the childhood form, that can occur either for no reason, or it's familial, or it can cause because there's an underlying neurologic issue of some sort. In my practice, it could be arthrogryposis, it could be a dwarfing syndrome, it could be a hemiplegia or a scoliosis or a cerebral palsy. Any of those reasons can also give you scoliosis.
Okay. And so what are the symptoms that someone should look out for?
So ordinarily, there are no symptoms. There is very little back pain associated with it, or there could be some. It's usually not very severe. If it is very severe, then you start thinking maybe there's something else going on. Is there a tumor? Is there something wrong with the spinal cord? Is something else happening? But usually it's just a curvature. Someone notices a shoulder is higher, or all of a sudden, a girl's in a bathing suit and her parents notice that, or a friend that she has a prominence in her back. So I think it's more of an exam kind of thing than it is a symptomatic kind of problem. It's not usually that people complain of things, but they can, and that would guide me towards sort of a different diagnosis.
Got it. And are there any, and now take for granted, I do know a lot about scoliosis, so I'm just covering the gamut for my community. But how is scoliosis diagnosed? I actually do know the answer, but I'm going to let you provide it.
That's great. You can tell me. So, it's diagnosed on exam. That's number one. You start with exam. You have someone forward bend, which is called an Adams bend test. And you forward bend them when they're wearing a bathing suit or something like that. And basically, you could see a prominence and you see asymmetry. So that's number one. And then you get some type of form of X-ray. I would tell people they should get a low-dose X-ray. There is low-dose radiation X-rays these days made by a company. And we have that machine here. There's a couple of them in Manhattan, and they have them in different university settings. And we have a few, there's some elsewhere as well, that at about 1/12 the radiation, but it's still like an X-ray. And then we have a machine also that can look at this almost like a map is made. It's called a cartography, and that's called a DIRS, and that's another way to formalize the diagnosis. The diagnosis is made on exam, and then you formalize that diagnosis on some form of X-ray.
Got it. And now, is scoliosis a lifelong condition, or is it something that someone can outgrow?
So it ordinarily is lifelong. Once you have it, you have it. It may not get worse. It may be the same always. Once in a while, a young child who can have it can be braced and early on, like in infancy or in early childhood, and it can actually get better and go away. So there are times when it goes away, but in most cases, it is a lifelong condition, but doesn't mean it's progressive. It could just stay where it is and be very mild and have no impact on someone's life.
Mm-hmm. And now, what are the different treatments if somebody is experiencing lower back pain as a result for scoliosis?
Well, even if they're not, even if someone is not having low back pain or mid back pain with scoliosis, there's still treatments for scoliosis. And I think that you could start with that. When maybe 10 years ago, I would have told you there's no such thing as physical therapy for scoliosis, but there are specific physical therapy exercises, and one of them is called Schroth or Schroth. And we have 4 therapists here who do it. There's a number of people in Manhattan who are very good at it. It's a little hard to get as you move away from the major cities or major metropolitan areas to get people who are truly trained in doing this Schroth therapy, but it's very worthwhile. But if you say like low back pain, core strengthening, Pilates is outstanding for the back. But in terms of treatment for scoliosis, you get to things like this specific type of physical therapy called Schroth, and then you talk about things like bracing if people are growing and things like that. But you start off with what's called, I call it, Schroth therapy.
Right. Okay. And so what is the difference between children who have scoliosis and adults, or is it kind of the same thing?
Yeah, it's not the same thing at all. The difference between adults and children is completely different. So you could have adults who had childhood scoliosis who became adults, right? We hope they become, so that is the same, although usually in adulthood, if it doesn't reach a certain degree, by the time they reach adulthood, it doesn't progress. So let's say you have a 13-year-old who has a 25-degree, which is measured in degrees, scoliosis, and they reach skeletal maturity. They're 17 years old. They have a 25-degree curve. That curve will unlikely progress. That will not likely progress. 85% chance that curve will stay the same forever. Mm-hmm. Now, so that person as an adult has the same scoliosis they had as a child, and that would be the same thing. However, adults, as they get older, can get degenerative changes, arthritic changes in their spine that can give you what's called the degenerative scoliosis. Now, that's a completely different issue. That's like arthritis in the spine that usually is associated with pain and can become progressive as well, and is treated mainly with physical therapy, sometimes injections, and sometimes surgery to fix it.
Right. And now, are there any psychological, emotional aspects to scoliosis?
So there's a great deal. So I think that especially because scoliosis is most often diagnosed more severely in adolescent young women, I think that there's body image issues. People develop body image issues with scoliosis. So I think it's always a concept you're discussing, and I'm always interested as I'm treating scoliosis, is how the girl is impacted by it, or how the young woman is impacted by it, the young man or the young man. How are they impacted by the observation of them having an asymmetry of some sort? And are they impacted? And some kids are very impacted by this, by their body image, and would need to see someone or need help for it or need to try to work that out, or perhaps even fix it in someone who has a moderate curve so they can actually treat that body image issue so they don't have to live their whole life. I mean, I think when I first started practice, I would have a number in my head, 50 degrees. And if it was 48, I didn't want to fix it, and then, but some young women came to me and said, I don't want to live with this. I don't want to have this prominence in my back my whole life. I want you to fix this. And you can even go one step further. There's times when we fix it, and if body image is a big reason why the people are doing it, you can remove pieces of rib, which makes people more symmetric. So again, I think it is an issue. I think body image is an issue, and it's part of when we do scales for testing, people with scoliosis, when we do outcome measures, one of the outcome measures is body image.
Okay. And now, would somebody who has issues with body image and so forth, would the best solution be to consult some type of, obviously, psychologist? Now, would there be, a specialized, psychologist to see, or just somebody in general?
Well, I think it's usually someone who deals with adolescent. I mean, since adolescent girls are the most common people associated with this, I would say it's just someone who deals with adolescent psychology. I think that they should see them, and it should be a team. I mean, they can work with the surgeon or the rehabilitation doctor to try to work with them and understand this is real. This person is truly feeling this. It's not just some emotional overtones. It's something else is bothering them, and they're allowing this to overtake them. So I do think that those are the people I would look for. Certainly people who specialize in adolescent psychology.
Okay. And lastly, what advice would you give to parents or to adults that are either affected with a child that has scoliosis or an adult?
I think that this would be something that I would tell all of the people on your group, because if different and able is what you're after, then being different does not mean you're not able. And the more parents treat their children, no matter what condition we're going to talk about in the future or today, whether it's scoliosis or cerebral palsy or any other condition that we can mention, the more you empower the people who have these conditions, and the more you empower their difference, and do not make it a disability for them because you view it as a disability, because you as a sibling or a parent or a spouse or a partner, because if you view it as a disability and you view it as something horrible in quotation marks, then they're going to view it as that. And especially for a young child or an adolescent who is in their formative years of developing their self-image and their self-worth, I think it's exceptionally important to empower them. And nothing else that I've learned over the years of seeing people with amputees or any other condition. I treat a lot of arthrogryposis or skeletal dysplasias or scoliosis. The more the parents have empowered them, the more the parents have said, not even empowered, they just made them feel they were normal, which they are, then that is what they should be doing. And then just seek a specialist in that condition if you want to be treated. But that's easy. That's easier than the first part.
Right, of course, of course. Well, this has been awesome. Thank you. This, I think, brief overview was wonderful.